Okay, thank you so much, Dr. Jeon and all of our participants. In an unusual stroke for an online symposium, we have a few minutes left for questions. I think about 8 minutes in our section. What I would like to do is maybe summarize some of the questions that have been asked and now answered in the chat. And then as questions come in, we can direct them to the panelists. The first question was asked about if the code for Goyal was available for security review. And the answer to that is yes, it's open source code that should be available in a number of links. We will try to put a common link here in the chat. And also we're going to respond to all questions and send out a written response to these questions to all the panelists afterwards. So you'll get that. Another question came up about whether or not this was if there was truly a network effect. And while we saw a very large increase early, you can see what looks like a linear change. One, we don't really have the data underneath this to know how things are changing, but as the questioner brought up, when you have people who are sharing, telling everybody else they know to add an app, you see a more exponential rise in a network effect, and we haven't yet seen that. And I think that that's on us to make this a trustworthy and a useful app, but also to communicate to Californians that this is so, which is the purpose of the symposium. But it's also on the people of California to adopt. This is the power of public health in people's hands. We had another question here related, I think, to how we are actually computing the ABM. And I thought I would actually direct that to Ravi, Dr. Goyal. This is from Joanna Maisel. What value is being used in these models for the secondary attack rate for notifications, and where does it come from? This is actually an excellent question. Not actually, this is an excellent question. Ravi, would you please answer it?
Thank you, Eli. Thank you for the question, Joanna. It is a great question. So there is we presented two different modeling approaches. For the ABM, we don't explicitly say what the secondary attack rate. Rather, the secondary attack rate is occurs after sort of specifying how CA Notify is implemented. So we have the number of individuals adopting, using interactions, uploading codes, and then sending out those notifications. So the number of sort of notifications then kind of dictate internally the secondary attack rate that we see. So it's not an input into the model, but rather something we can observe post. In contrary to when we were looking at the approach from the Oxford UK model, one of their approaches, they also have many other different approaches, but one of the approaches is pre-specifying what that secondary attack rate. And in the range, we went between 2% and 6% for a secondary attack rate.
Thank you, Ravi. I would also point out, we know there's some selection bias in our surveys, but seeing an 11% positive of people with symptoms, which means there's probably more, it does tell us that our in-group secondary attack rate is very clearly non-zero. So as Ravi said, the intervention is getting to where the disease is. It's also incredibly hard to model this.